My name is Roberta Mussinelli. I've been working here at the Amyloid Center in Pavia since 2017. I graduated in medicine and then specialized in internal medicine here in Pavia, with thesis in both cases regarding AL amyloidosis. Then I obtained my PhD in medical therapy and in master in echocardiography. During my residency, I came here to the center to learn more about this disease, especially by working together with Professor Perlini, focusing on the diagnosis and the management of cardiac amyloidosis. I spent 6 months in Boston at the BU Amyloidosis Center, working together with Professor Ruberg, and I learned a lot from a cardiac point of view. And then, thanks to the weekly meeting together with other specialists, like Professor Burke and Professor Vasciali, I learned more about the other aspect of the disease and the importance of working as a team, as a multidisciplinary team. Together with another cardiologist, we are responsible for the cardiologic evaluation of our patient. So we perform echo and ECG in order to look for heart involvement. Then, of course, we're responsible for the cardiac supportive therapy in our patient. So we need to decide whether and how much diuretics are needed or antiarrhythmics our patient may need, and we give indication to put devices in if needed. We also need to collaborate with the emergency room because, unfortunately, sometimes our patients need to be hospitalized. So we have a good collaboration with them as well. And we are also responsible to evaluate the cardiac response to the specific treatment in our patient. In my opinion, there are several benefits of the multidisciplinary approach, both from the patient and caregiver side and from us as specialists as well. We know that the cardiac involvement is the main driver of the prognosis in this patient, but the impact the other organ involvement have on the quality of life of our patient is also very important. And given the systemic impact of this disease in our patient, it is important to fully evaluate the patient, the complete evaluation of the patient, not only from the cardiac point of view, in order to establish the complete burden of the systemic disease in our patient. And that's helpful for the patient as well, because they can be evaluated in just 1 or 2 days, so that's easy for them, and we can provide them with the correct therapy and the most appropriate therapy for their problem. Together with the other specialists, we can also address more health problems at the same time in order to give the patient a full plan for the disease. For me, as a specialist, it has been very important to work as a multidisciplinary team because I learned a lot from my colleagues, and now I'm able to take into consideration the other organ involvement while I'm prescribing my supportive cardiac therapy in the patient. For example, it's very important to take into consideration the dysautonomic problems that our patient have when I prescribe diuretics or beta blockers, because I want the treatment to be helpful for the patient and not harmful. So I think that's one of the main important things that I learned from my colleagues. Cardiologists, hematologists, and pathologists are always available here at the center because they work directly here in the center a full week. Instead, the neurologist and the psychologist, for example, they come 2 days a week here at the center. So it's very important to plan ahead the visit of our patient in order to put them in the right day if they need the cardiologic evaluation rather the neurologic evaluation. So we need to discuss before what the patient needs to do in order to plan it accordingly during the week. At the center, it's also possible to perform the bone scintigraphy and MRI, cardiac MRI if it's needed. And that's also important to know if the patient needs this according to their history, their medical history or their clinical findings, because we need to adjust that in the right moment as well. With the specialists that don't come directly to the center but that work in the hospital, we communicate by phone and organize a specific visit, like nephrologic visit if needed, dermatologic visit, or whatever our patients need in that moment. And in order to facilitate the communication among the different specialists, well, for the specialists that come here, that work here, on a day-to-day basis, it's very easy to communicate because we just meet each other basically in every corner. So we have frequent talk about our patients. And then we plan a small meeting according to the cases we need to discuss. We can do that in real life, or we can also do that thanks to technologies that can help us do the meeting online in a secure way that's provided by our hospital. It's a telehealth system that we can share private information about the patient in a secure way. Delay in diagnosis and early diagnosis is still a challenge in this disease. So it is the same for us in our center. What we have is that working together with other specialists, we can shorten the time to reach the correct diagnosis. And it's also very important to collaborate with the pathologist that can help us have the correct diagnosis. So this is a challenge that we can overcome by working together. And other challenges in the last period, in the last years, is that we are receiving increasing amount of requests for visit, and it's not always easy to satisfy this question. And in this case, the collaboration also with other centers around, and not only inside our center, can help us, because we can refer the patient that has already a diagnosis to the local center closer to the patient's home, and they can do follow-up there or do their therapy there. And so we can leave spots for others to come to the center and do their workout in order to reach the correct diagnosis. And another challenge may be the difficulty in following up patients that come from far away in our center. So in this case as well, the communication with local center is helpful. And another thing is that we do also a lot of clinical trials in the center and research, which is very important because we can give early access to innovative therapy to our patient as well. But sometimes it's not very easy to integrate the research and the clinical practice. And being in a team, that's also helpful for us. In this center, we also do a lot of research. We participate in clinical trials, which is very important for our patient because we can give them early access to innovative therapy, but sometimes it's not easy to integrate the research with the clinical practice. And being a team, that's helpful because we can divide the work and collaborate in this way. In my experience, it's very important to have a dedicated specialist for this disease, because having to collaborate with the same person over and over, that makes communication easier. And then as a specialist, I learn more and more every day. So I built my knowledge of the disease, and so I can be more effective with the patient and in finding and solving problems that the patient have. So I think that's important to identify one person, one or two, but some person that are willing to be involved specifically in this project, so they are interested in the disease and they can give time and spend time learning and collaborating with the other specialists. So that's for sure very important. And then make communication easy among the specialists is also very important. So to set specific time to talk, collaborate, and discuss the cases, it's important because our schedule is very busy. And so if we leave it by the chance, maybe it's not working, especially at the beginning. So we need to set specific time in everyone's agenda so that we can do this meeting and learn and decide and make decision and plan for our patient. It doesn't need to be a long time. Sometimes it's very quick, but it needs to be planned. And last but not least, I think it's very important to have the laboratory and the pathologists that work with us, because they're important and determinant in the diagnosis, which is necessary. It has to be correct in order to give the correct therapy to the patient. So that's one main important thing that we have in our center.